having me. My name is Fiona. I am a doctor from South Africa, and I am doing my PhD at Oxford University at the moment. And can you see? There's a globe twirling around on the slide. But our topic for today is imagining what if there were no pandemics. Now, I guess that you guys are probably a little bit sick of the pandemic by now, but it could be nice just to for a moment imagine something different. So, we're going to start by reimagining today. Okay, so I want to invite you to close your eyes. I'm going to close my eyes as well. I'm going to trust that you're doing the same because I won't be able to see. Close your eyes. Okay, imagine you're waking up, so your alarm is going off, you're waking up for this morning. But something has changed overnight. Okay? Overnight, the pandemic has ended. But you don't know it yet. So you're waking up, your alarm is going off, maybe getting out of bed, maybe like walking to the kitchen to go get breakfast, and wondering what will be the first sign that you notice that the pandemic has ended? Because nobody's told you yet. You're going to notice it by the little things that is different in your day. So maybe it would be that the TV in the background on the news, nobody says the word pandemic. Or maybe it's even when you are walking to school, you notice, oh my goodness, nobody's wearing masks anymore. So we are imagining today where all of a sudden the pandemic is over. So open your eyes again. How did that feel? Was that a good feeling? For me, it was pretty pleasant. Like, thank goodness, no? So, just coming to the next question. So, I was using a vague term. I was saying we're waking up and there's no pandemic. What is a pandemic? Can you think of examples that is not COVID of a pandemic? Yes.
It's the Spanish flu.
Spanish flu, excellent. Yes, so that was caused by influenza, the virus. Yeah.
And the Black Death.
Black Death, yes, absolutely. Any other examples? More pandemics that you've heard about? Yeah. Okay. The plague, absolutely. Yeah. Great job. So we've actually had quite a few pandemics. Some we don't know about now because the vaccines have been remarkably effective. Okay. So measles caused pandemics in some countries. You were actually right, influenza. There's one that is very, very interesting, and it's called smallpox. And it's the one example of a disease that we've managed to completely eradicate from the world through vaccines. It's a massive success story because it's actually 1 in 3 people who got smallpox became so ill that they died. So it was a really, really serious disease. And we can speak a little bit more about how the smallpox vaccine was developed if you're interested in it in the question time afterwards. But even if we look at what the definition of a pandemic is, it says it's an outbreak of an infectious disease that spreads over a large area. So it's usually in different countries at the same time, and it affects large numbers of people. Some pandemics don't make people very sick, but then there can be small changes in the virus, and then suddenly the term for that is virulence. Suddenly it becomes more virulent and stronger, and people can become more sick. Okay. That's the definition. Can I tell you, we've spoken about examples of pandemics. Can I tell you what I thought about when we were doing that imagination exercise where we said, what if we wake up and there's no pandemic? I thought about my own country, which is South Africa. And that's where I used to work as a doctor. You can see there on the left, it's me and my friend who was a medical student at Oxford at the time. He came to visit, and it's one of my colleagues who was working in the clinic. And so I was working in a small hospital in the Eastern Cape of South Africa, and this day I want to tell you the story about what happened on this day. Why am I sitting underneath an umbrella when I'm supposed to be working in a clinic? So on this day I got into the car, drive about an hour and a half on these bumpy roads to get to the clinic. But I knew in my boot of my car, I think the boot not what is the boot in English word for boot?
I would call it boot as well.
You call it the boot? Okay.
Yeah.
In the boot of the car, I had some medication. And I was going to start someone who has drug-resistant TB on treatment. Now, who of you have heard about TB before? Tuberculosis. Oh, you know a bit. Yeah, a little bit. heard about COVID before? Everyone. Okay, so we're tired of COVID, but we haven't really heard that much about TB. So that day I was going to start someone who has quite a severe form of TB on treatment. Now, TB spreads via the air. So I knew that if I go into the clinic, there's 80 patients waiting to see me that day. A patient will be one of them. If I sit in the clinic, he also comes through, waits for an hour or 2 hours in the queue, there's going to be a risk of everyone else waiting in the clinic could become exposed to TB. So that's why on that day, I said, whoa, the weather is looking amazing, the sun is shining, let's have the clinic outside. So we put up the umbrella and we were seeing people outside. So that is what I thought about when we thought about the day where there's no pandemic. I thought about this day, and I thought about most days when I go to work. I would see wards of people who are really, really sick because of tuberculosis. And why I want to tell you a little bit more about that is in South Africa and in Russia, in India, in Brazil, in some parts of China, tuberculosis is a current pandemic, but it's affecting only certain parts of the world, so that's why we don't hear so much about it. But if I could have a wish to wake up where there's no more pandemic, I would absolutely pick TB. I'll tell you. So next, I want to tell you a little bit more and compare these two diseases. So if I see someone who's coughing in South Africa, I was at home in December, I was doing some fieldwork for my PhD. I saw someone who was coughing. I actually wouldn't be able to tell whether that person has COVID or whether they have TB. We would need to do a test. So with COVID, you do a swab test. With TB, you do a sputum test, where someone tries to cough up some of the sputum in their lungs. But let's compare the two next to each other in that table. So COVID is caused by a virus, SARS-CoV-2. TB is caused by a mycobacteria. So it's caused by a type of bacteria called Mycobacterium tuberculosis. And then when you look at the symptoms, they're pretty similar. There's coughing, there's fever. COVID has loss of smell, which is an interesting one. And tuberculosis usually takes a little bit longer. So you might be sick for 2 weeks, whereas COVID would be most of that. But then I want to tell you why TB is such a tricky disease. Say, for example, I am exposed to someone with TB today. Okay? Say right now, I'm exposed to TB. It will take around 2 years for me to start getting symptoms of TB disease. So now I say, oh, 2 years time. Like that will be 2023. Then I start coughing, I start having nonsense, now I have to think back 2 years ago. Where in that period of time did I become sick with TB? How do I know who else should go and test for this disease? Yeah? So that makes it quite tricky where if we compare that to COVID, that incubation period is quite quick. I'm exposed to someone with COVID today, within 4 to 10 days, you become sick. So can you see why TB is such a tricky disease to try to stop? Why that pandemic is really difficult to stop. But in that last line, you'll see that in 2020, we're estimating that around the world, 1.9 million people died of COVID. So it has caused a lot of suffering. But right next to that, so we only have data for 2019, we saw that 1.4 million people died of TB in 2019. So it is a really severe disease. Okay, so now I want to ask, can you think of ways in which we can end the pandemic? Yes. Vaccines. 100%. What else? Yes.
If the disease spreads by touch or by air, quarantine and social distancing.
Absolutely, yes. Brilliant. Lockdowns, absolutely. Great. I feel like you've got the crib sheet of what has happened over the past 6 months. Excellent. No, you are on top of it. So I'm going to divide it into 3 categories. And we can maybe think about different diseases. So we'll start with maybe cholera. Have you heard about cholera? Yeah. So it's called, what kind of complaint did you have? Yes.
I think it was like a water.
Yes, brilliant. So John Snow was the epidemiologist who discovered cholera spreading by water. It was actually an infected handle of a water pump that was spreading it, but it spreads through contaminated water. Yeah. So let's use cholera as an example. So there are 3 ways in which we can end the pandemic. So the first way, it's called primary prevention. So if it's cholera, for example, that spreads via the water, we want to make sure the water is clean. So that could be making sure we don't use water straight from the river, we use water that has been treated and cleaned through the tank. If we're thinking about a disease that spreads via the air, like tuberculosis or COVID, it means we open up the windows. And I like this picture. I don't know if you can see. It's a picture of lots of balloons that are stuck in a room. And what primary prevention tries to do is, if you imagine those balloons are infectious disease, so if it's a respiratory virus, it will be the droplets. If you open up the windows, those balloons will start going outside and they will be diluted. And so that is exactly what primary prevention does. So either we remove the infectious diseases from the water, or we try to dilute them with fresh air if it's spread by the air. That's primary prevention. What also fits with primary prevention is vaccines. And so I think you've heard quite a lot about them, but what makes them excellent is, yes, they protect the person from becoming sick. So from, if I get, for example, I've had my COVID vaccine, if I then become exposed to someone with COVID, I'm less likely to become sick. But the other good news is it also means that if I get exposed again, I'm unlikely to have that whole chain of making other people sick. So that's why vaccines fall into the primary prevention, because in a way, if you're thinking about diluting the number of potential sources of infection, that's also how they work, because they break that chain of how it goes from person to person. Okay, the second way in which we can end a pandemic, are you ready for number 2? Okay, the second way is saying, okay, this is called secondary prevention. It's saying, okay, so we've got a whole lot of balloons in the room, there's a whole lot of infectious particles. Let's put on a mask to see if we can either prevent us from making more infectious particles or protect the person from wearing a mask. So that's secondary prevention. Do you see how it's slightly different from primary prevention, where we're trying to remove all of the infectious droplets or particles? And the secondary, we're trying to protect people from being exposed to it. Yeah? So those are the two differences. An example, if we think about malaria, what do you think would be primary prevention, and what do you think would be secondary prevention for malaria? So malaria spreads through mosquitoes. Excellent. What would be primary prevention? Yeah.
Worrying check the patterns and notifications.
Exactly, yeah. And then trying to get the mosquitoes away. Yeah? Yeah. Excellent, excellent. And what would be the secondary prevention for malaria?
Would we like having nets and stuff?
Brilliant. Yes, exactly. Oh, you've got it. Okay, so that's the difference between primary prevention and secondary prevention. Now, just to be a little bit exciting, let's add tertiary prevention. This is not applicable to every pandemic, but for example, if we think about HIV, treatment can also be a form of prevention. Because if someone starts treatment for HIV, they become, and they take that treatment every day, they can't spread that disease to other people. And so that's also a way to end the pandemic. So this would be tertiary prevention for prevention as treatment. So those are the 3 ways. I want to come back to vaccines, because I think all of us are really excited about the COVID vaccines becoming ready and really helping us to return to a bit more of a normal life. But I want to tell you about the tuberculosis vaccine. So it's called BCG. It was named after the people who discovered it, the so-called vaccine. But this year is the 100-year anniversary of the TB vaccine. So it's 100 years old. So the next question should probably be, okay, if it's that old and we're still using it, does it mean it works? It's a great vaccine. And unfortunately not. Unfortunately, it's quite a poor vaccine. It doesn't work that well. It helps us from preventing severe TB in children, but it actually doesn't protect adults, and it doesn't protect us adolescents. So it's not a great vaccine. But if you look at that table, you can see, okay, the second line, it says the TB vaccine was developed in 1921, 100 years ago. The COVID vaccine, it was developed last year. There are 109 different kinds of COVID vaccines in development. There are, whereas over this 100 years, only 14 for TB. If you look at the number of approved COVID vaccines, there's 14 at the moment. There's still just one for TB. And then that last line is actually the reason for all of this. If you look at the amount of money that we are spending to try to develop a better COVID vaccine, you see that is $8.5 billion US dollars. That's a lot of money. But if you look at TB, $0.1 billion US dollars. So seeing that slide makes me really unhappy because I'm thinking about all of the wards full of TB patients. I'm thinking my aunt had TB. I'm thinking about I can put the names to all the people. And so this to me is the reason why I do research in TB, because I think it is still a massive problem. It's still a pandemic. And there are some really encouraging examples of other pandemics that we are managing to do really well with. So for example, there's some excellent vaccine candidates for COVID. I'm hoping some of that research and technology we can also then use for TB. So that's the talk part. I am really excited to hear your questions. Yes.
Are there any other current pandemics other than
TB and COVID? Yeah. Good question. And yes, there are. What makes it tricky is often we are not quite aware of what is happening at pandemic proportions around the world. So there are some really big cholera outbreaks in some countries, especially where there are a large group of people that are living without water and sanitation being supplied, so they have to use a shared river or something like that. So there are, so we've had some cholera outbreaks. Some became epidemics, and then if they spill over to different countries, yes, they become a pandemic. But I think if we're really looking for large multi-country pandemics, I would say the two biggest ones would be TB and COVID. And some people would also add HIV into that. They would say HIV is a pandemic, but there are many reasons to be hopeful about HIV. The trend is really declining. Yeah. Yes.
So what if there was no pandemic?
Oh, wouldn't that be amazing? Huh? It's a good question. What if there were no pandemic? I wouldn't have a job anymore, but I would be so happy about it. I wouldn't complain one bit. I think that the question becomes interesting if we say, okay, how can we use what we know about primary prevention, secondary prevention, and tertiary prevention to not just focus on current pandemics, but maybe future pandemics? And so a lot of people are saying with COVID, we've learned how important ventilation is. And ventilation can prevent the spread of many airborne illnesses. So it works for COVID, it works for TB, there's a new paper saying it also helps for flu. And so some people are saying, why aren't we using this chance to improve ventilation in all of the indoor public spaces? So restaurants, sort of any communal place where there's a large group of people, so that when there's a pandemic, it doesn't, and it spreads by the air, it doesn't have such a large outbreak. Yeah. Yeah, next question.
Obviously, it would be good if there were no pandemics, but then surely there'd be overpopulation.
That is a good question. So it forms part of a bigger question asking what impact does trying to improve the health of people have on the global population, right? And there's been some interesting work on that. The one piece that I would tell you about is it was done by Max Rosen and Hans Rosling. Max Rosen has this website called Our World in Data. And they say that as the health of a country improves, people start having less children. And so, similarly, if there's a large pandemic outbreak, or if there's poor health outcomes, say for example, I live in a country where there's poor health care, I might have more children because the chances of one of my children surviving to adulthood is less. So I think it's an interesting question. I think we should keep it in mind. But generally, the trends show that as people become more healthy, they start to have less treatment. Yes.
Can tuberculosis survive when
So can tuberculosis survive if it's not on a living thing? So tuberculosis can survive for around 6 hours in the air. So say, for example, I'm sitting, have you seen a minibus taxi? Like it's not the cab. It's like a combi. You know combi. There's lots of people in it. Okay, so we have lots of combis in South Africa. Like they're a very common form of public transport. And that's actually, we're worried that that might be one of the places where TB spreads a lot. Because if a lot of people, often the windows are closed, and if someone with TB speaks or coughs, that TB can then hang in the air for 6 hours. But how can we prevent that? What advice would you give to someone getting into a minibus taxi in South Africa to protect them from TB? Open the windows, brilliant. And put on a mask.
Yeah.
Absolutely. Yeah. Great. You guys are really, really great pandemic experts. Yes.
What do you call like it's just in one singular place, isn't it? Like
Yeah. So epidemic. Yeah, that would be an epidemic. So if it's only in one country, and the moment it starts affecting a region, so multiple countries, then you would say pandemic. Yeah. But good question. Yeah.
How quickly can a pandemic be discovered and stopped? Because obviously the first cases of COVID were in 2019, but then it was only really on the news in like mid-January.
Yeah.
So by the time like it's been discovered, would it be too late because too many people have already been infected but just haven't had symptoms?
Yeah. Yeah. Such a good question. I think how quickly we can pick up that there's a new pandemic really depends on how good we are at doing surveillance. And so what surveillance means is if you are working in a hospital and you are seeing something unusual, so maybe more people with COVID, with more people coming in with pneumonia, so having chest complaints. Doctors are really quick to pick up and say this looks like it might be first aid, so it might just be an outbreak, so just something in that specific small region area, and then realize, whoa, it became an epidemic and a pandemic. So if we want to be faster in picking up pandemics, we need to strengthen that first part of being able to pick up. What really helped us with COVID is the researchers who initially found out, oh, COVID is a problem, they shared their knowledge, they shared sort of the exact gene sequencing of what COVID looks like with the world. And people could then immediately start developing vaccines. Can I tell you an interesting story? Have you heard about the vaccine that was developed at Oxford?
Yeah.
The AstraZeneca. So that was the vaccine that I got. So can I tell you an interesting story? So they were busy working on that vaccine for the past 20 years. How does that work? Yes, I was also puzzled when I read it. And what happened? Yes, do you know?
Is it because that COVID is much earlier? It's just booming now, so it's out there.
So that's a good thought. We're almost there. Yeah.
Were they sort of getting a vaccine ready for the next pandemic, and all they had to do when the pandemic came was like add dead proteins from the virus?
Yes. So they were working. So coronavirus, it's a family of viruses. So there are many types. And so SARS-CoV-2 is one of them. And so they were working on a vaccine for the MERS. There was a MERS outbreak, which is another kind of coronavirus. So they were ready, working on it, figuring out, okay, how will we give it? What is the dose? How do the proteins work with each other? And then when SARS-CoV-2, COVID came along, they literally took that piece of genetic code from the SARS-CoV-2 and they put it exactly into the vaccine that they were already developing. So in a way, with that specific AstraZeneca Oxford vaccine, we were really lucky that that piece of genetic code was put in. But to come back to your question, people are saying having many different vaccines. So we know which viruses could cause pandemics. And we've known for a long time that coronavirus is a risky virus. It can change the way the body recognizes it quite quickly. So we knew that the coronavirus there's a potential for a pandemic. And so now people are saying, okay, but let's get better prepared. Let's start having vaccine candidates that are almost ready for all of the virus families that we think could be problems in the future, so that next time we can be even faster. Yes.
Wasn't it predicted in 2015 there was going to be a pandemic?
So I think I would go further than that, and I would say that in the medical community, we've had a couple of, do you know when you're about to run a race and the starting gun goes and you stop and then it was a false start? And we've had a couple of false starts for pandemics over the past 20 years. And I mentioned MERS, which was a Middle Eastern Respiratory Syndrome, so that was one example. It was a bit of a false start. We were ready before a pandemic, it was spreading, but fortunately, it didn't spread between people, as you said. So there was a small outbreak, but it stopped. So I think I would go further. I would say, because humans and animals live so closely to each other, because we are so interconnected, pandemics is unfortunately one of those risks of life. And so we know that there will be more pandemics in the future. So we should focus on how can we use all of those preventative tools to act fast and to make sure they don't cause a lot of devastation. Yes.
Do you think we'll see another pandemic in our lifetimes?
I would say we still have TB to fight. So let's get, but I think, I hope, I think that there's been a lot more attention globally on pandemic preparedness. And so in the ideal situation, all of the countries across the world looked back at COVID and said, wow, it really disrupted our lives. How can we make sure that doesn't happen again? So part of it would be, like we spoke about, preparing vaccine candidates. Part of it would be making sure our air is quite safe. Because I read the paper the other day that said, look, why are we making sure our water is clean, but we don't make sure that our shared air is clean? So those are ways in which we can really try to prevent another one from coming. But in a way, more pandemics in the future is inevitable. What we can do is try to use the prevention tool that we spoke about.
Thank you. I'm very sorry. Thank you so much. Can we give a big round of applause? Would you move on?